This is the Coronavirus Morning Report for Tuesday, April 28th, 2020. I'm Jackson Bird. Reopening plans take shape across the globe, and the R-naught number is the metric communities are watching closely. Data suggests that Americans are increasingly not waiting for the official word to leave lockdown, an over-the-counter heartburn remedy that might be a tool against the virus, and a comprehensive $46.5 billion blueprint to reopen the economy with the aid of testing and tracing from some of the experts we quote all the time on this show. More news on reopening. The country of Austria is officially ending its lockdown at the end of April, so in a matter of days. 75% of New Zealand's economy has officially reopened. Nigeria is considering easing lockdowns next week, but Argentina is extending a flight ban until September. All commercial flights to, from, or within that country are banned until September 1st. Alert about a metric that will become increasingly important as places attempt to reopen. The R-naught number. Written out as R0, it represents the number of new infections estimated to result from a single new case of coronavirus. So if the number rises to 1 or above, that means one person with the virus is expected to infect, on average, one other person. This metric is important because it measures whether or not the virus is spreading in a population. Early on in the disease, places were seeing R-naught numbers of 2 or 3. If it's less than 1, eventually the disease would peter out because not enough spreading is occurring. As an example, Germany is concerned because the R-naught in that country has risen back to 1.0, again, on average. Quoting the New York Times, the number was up from 0.7 on April 17th when Chancellor Angela Merkel and the governors of Germany's 16 states agreed that the country could begin taking steps to ease the restrictions imposed on public life. At the time, the chancellor warned the restrictions could be reinstated if the virus began spreading more quickly. Germany's rate of reproduction stood at 3 before people were ordered to stay home. The number should remain below 1.0. Lothar Weiler, president of the Robert Koch Institute, told a news conference on Tuesday, "The lower the number, the more wiggle room we have," end quote. Even here in hard-hit New York City, officials are edging toward a partial reopening in May, but Governor Cuomo described the process as a patchwork, with some places resuming activity sooner than others. And speaking of New York, they released more antibody testing numbers that are slightly up from last week. The data suggests that 14.7% of people statewide have been exposed to the virus, and 24.7%. or 1 in 4 people in New York City have been exposed. And the takeaway from this? If these numbers are accurate, then the fatality rate from the disease is pretty much what people thought all along, somewhere between 0.78% and 1.3%, and the number of cases would be 10 times more than currently confirmed. So that 10 times rule of thumb we talked about is holding up, at least here in New York, where a lot of testing is being done. New York City is also moving forward with increased testing in aid of allowing activities to resume more generally, quoting NBC New York. Going forward, people who go to one of the city's testing sites will be able to swab themselves. They'll use guidance from a healthcare worker, but it'll require no direct contact with that healthcare worker. This self-swab test was approved by U.S. regulators last week. Private labs will have to step up to process results quickly. New York City Mayor Bill de Blasio says the city is looking into new partnerships. End quote. Nevada and Colorado have joined that group of western states, including California, Oregon, and Washington, that are coordinating their reopening and testing plans. Cell phone data collected from the University of Maryland shows that many Americans aren't waiting and are starting to leave their homes more and more over the last 2 weeks. Quoting the Times again, starting in mid-March, when most stay-at-home orders were announced, fewer people went out and people also made less frequent trips, according to the research. For weeks, the numbers held steady. Then, starting on April 14th, the data showed people increasingly going out, a trend that continued through Friday, said Li Zhang, director of the Maryland Transportation Institute at the University of Maryland College Park, which is leading the research. Dr. Zhang called the phenomenon quarantine fatigue. It appeared to be on display this past weekend as throngs of people packed beaches in South Carolina on a hot Saturday, despite pleas from public officials to consider staying indoors. End quote. Meanwhile, a Washington Post University of Maryland poll shows that Americans overwhelmingly continue to support state-imposed restrictions on businesses and public gatherings. Nearly 2 in 3 Americans say the restrictions on restaurants, stores, and other businesses in their states are appropriate, with just another 16% saying they're not tight enough. Just under 2 in 10, or 17%, call the limits on business activity too restrictive. And last week, autopsies revealed that the first cases on the West Coast occurred weeks sooner than authorities knew. Well, the East Coast is now tallying earlier cases as well. It was March 7th when a rector in a church outside of Washington, D.C. became what authorities thought was patient zero in that community. But, quoting the Washington Post, on February 16th, a day after returning from a ski trip in northern Italy, 54-year-old education researcher Kathy Hughes woke with a fever, chills, a headache, and exhaustion. When the illness did not go away after a few days, she went to her doctor. Tests for flu and mononucleosis came out negative, but a doctor told her the flu test must have been a false negative. It didn't occur to them that it could be the coronavirus. On Wednesday, Hughes, now recovered from her illness, went to a doctor in Fairfax who administered a finger prick serology test. Within 10 minutes, it came back positive for coronavirus antibodies. If the result was accurate, it would mean the virus was likely present in the district at least 3 weeks earlier than believed. Although it's unclear whether she is immune, Hughes said the antibody test provided much-needed clarity. "We know that something happened to us, and we would like some kind of proof or understanding of what it was," she said. End quote. We've recently covered some of COVID-19's less expected problems, such as the disease causing blood clotting problems and even strokes among younger people. Well, there's a new problem to add to the list. Britain's National Health Service has warned doctors in the UK to be on the lookout for children suffering from a new and very serious combination of symptoms, including stomach pain and heart problems linked to the coronavirus. In a national alert, British doctors were warned of, quote, an apparent rise in the number of children of all ages presenting with a multi-system inflammatory state requiring intensive care across London and also in other regions of the UK. The alert added, there is a growing concern that a COVID-19 related inflammatory syndrome is emerging in children in the UK, or that there may be another, as yet unidentified, infectious pathogen associated with these cases. End quote. Now, it's important to say that very few children have presented with this syndrome so far, but the National Health Service felt it was sufficiently important to ensure all frontline doctors are aware of the problem so that any affected children can receive appropriate care. The cases so far, according to the alert, quote, have in common overlapping features of toxic shock syndrome, with blood parameters consistent with severe COVID-19 in children. Abdominal pain and gastrointestinal symptoms have been a common feature, as has cardiac inflammation, end quote. Some of the children have tested positive for coronavirus, some appear to have had it in the past, and others have tested negative for COVID-19. One intensive care doctor told The Guardian newspaper, quote, there's been an utterly unexpected uptick in severely sick children with a late inflammatory response that we think is related to COVID-19. It's most unusual. A number have needed ICU and at least one has required ECMO. ECMO, extracorporeal membrane oxygenation, is used when someone is unable to breathe for themselves. Professor Russell Viner, the president of the Royal College of Pediatrics and Child Health, told The Guardian, we already know that a very small number of children can become severely ill with COVID-19, but this is very rare. Evidence from throughout the world shows us that children appear to be part of the population least affected by this infection. New diseases may present in ways that surprise us, and clinicians need to be made aware of any emerging evidence of particular symptoms or of underlying conditions which could make a patient more vulnerable to the virus. However, our advice remains the same. Parents should be reassured that children are unlikely to be seriously ill with COVID-19, but if they are concerned about their children's health for any reason, they should seek help from a health professional. End quote. A bipartisan group of former health officials, including Andy Slavitt, former director of Medicare and Medicaid for President Obama, and Scott Gottlieb, a former Food and Drug Administration chief for President Trump, have written to Congress with a blueprint for reopening the economy based on a significant $46.5 billion investment in testing, tracing, and isolating COVID-19 cases. The officials propose including the investment in the next coronavirus rescue package so that reopening can commence before the widespread availability of an effective vaccine. Quoting from the letter, "To begin to safely ease at-home measures, it is of paramount importance to be able to provide broad, timely testing for COVID-19, diagnose COVID-19 positive cases, enable infected individuals to self-isolate at home or voluntarily in other facilities if home is not a safe option or if the individual is unsheltered, trace and alert those who have been exposed to an infected individual, and enable those exposed contacts to voluntarily self-isolate for 14 days after their last exposure to the infected person. This approach maximizes the chance new infections get contained before they turn into rapidly growing new outbreaks." End quote. The group calls for contact tracing and self-isolation, quote, "on an unprecedented scale." Accordingly, they propose investing $12 billion in recruiting and paying for a contact tracing workforce of 180,000 people, a number that assumes a continued but decreasing number of new cases. They noted that this should be achievable on a national scale, with Massachusetts receiving 15,000 applications for 1,000 open contact tracing positions in 2 weeks. The next step would be to invest $4.5 billion in paying hotels to house individuals who need to self-isolate but can't do so in their homes. Quoting again from the letter, "There is substantial evidence that providing a voluntary option to safely isolate will help to dramatically reduce spread of infection to one's family and therefore the spread of infection overall. We believe 14% of infected individuals and exposed contacts will need such an option. Hotels are largely sitting idle at present and can provide local options for such voluntary self-isolation sites. Utilizing otherwise vacant hotels over the course of 18 months will both maximize the ability to contain COVID-19 and also provide a much-needed stimulus for the hospitality industry across the country as hotels deliver an essential public service." End quote. By far, the biggest expenditure proposed is $30 billion over 18 months to provide income support for people who need help affording spending 14 days in self-isolation. Paying these individuals a stipend of $50 a day, analogous to federal jury duty, will greatly increase the success of containment efforts and the ability to maintain an expanded measure of openness in the economy. End quote. The money would be sent as block grants to the states twice annually until an effective vaccine is available, with the CDC charged with interstate coordination and the collation of best practices. In their conclusion to congressional leaders, the group writes, "We believe the direct impact of this investment, along with an adequate testing and containment infrastructure that links in healthcare providers and businesses, will have a significant economic impact, allowing Americans to get back to work safely and quickly, create employment, stabilize our healthcare system, and stimulate the hospitality sector. It is imperative that states and metropolitan areas are able to quickly begin and scale this important work, and we urge you to make this commitment as a part of the next stimulus legislation." NPR says the White House, which would have to sign off on the investment should it pass Congress, has been briefed on the proposal and will keep you up to date on developments as they happen.
It comes as no surprise that we're all stuck in our homes for a while, but you've still got to keep in shape, right? In fact, it's more important to stay active and keep moving than ever because it helps your physical health and your mental health. But how can you work out at home? That's where Beachbody On Demand comes in. Work out and even take classes in the comfort of your own home. Beachbody On Demand is the easy-to-use streaming service that gives you instant access to over 1,300 super effective workouts, suited for anybody at any time. The secret to getting results is just getting started. And this is key right now. These are workouts as short as 10 minutes that don't require extra equipment. Just stream a workout, find some space in your living room, and you're done. Why not take this time to get on the 21-day fix, for example? You can come out of this in better shape than you went in. Right now, listeners to this podcast can get a special free trial membership when you text BRIEFING to 303030. You will get full access to this entire platform for free. All the workouts, the nutrition information, and support totally free. Again, just text BRIEFING, BRIEFING, to 303030. I have another new Stamps.com convert in my own household. I told you how my mom now uses Stamps.com to send care packages to the grandkids, and now my wife, who has been sewing cloth masks to send to hospitals, but also to our family and friends, she's been using Stamps.com to print the postage needed to send those masks out to everyone. Anything you can do at the post office, you can do at Stamps.com, and yet you don't actually have to go outside and physically go to the post office. Simply use your computer to print official U.S. postage 24/7 for any letter, any package, any class of mail, anywhere you want to send it. And you save money with Stamps.com, something that's especially welcome right now. 5 cents off every first-class stamp and up to 40% off USPS shipping rates. So you can stay indoors, stay safe, but still stay in touch with the people you care about with Stamps.com. And also you can save money. And you can save even more right now because listeners to this show get a special offer that includes a 4-week trial of Stamps.com plus free postage and a digital scale without any long-term commitment. Just go to Stamps.com, click on the microphone at the top of the homepage, and type in briefing. That's Stamps.com. Enter briefing. Stay safe, my friends.
There's a new possible COVID-19 treatment on the block, and it's called famotidine. Famotidine is the active compound in the over-the-counter heartburn drug Pepcid, and on April 17th, COVID-19 patients in a trial at Northwell Health in New York City began receiving the treatment intravenously at 9 times the dosage used for heartburns. Until today, Northwell had chosen to keep the study quiet. Kevin Tracy, a former neurosurgeon in charge of the hospital system's research, said, quote, "If we talked about this to the wrong people or too soon, the drug supply would be gone." While the silence has broken on the study, Tracy is still hesitant to say anything about its efficacy either way until he sees interim results from the first 391 patients, saying if it does work, we'll know in a few weeks. Infectious disease doctor Michael Callahan, who is based at Massachusetts General Hospital and has spent time in disease hot zones worldwide, was the first to bring attention to the drug in the U.S. Callahan was in Wuhan in January, having been working on an avian flu project in Nanjing and gone with his Chinese colleagues to lend a hand when the situation in Wuhan worsened. Quoting Science magazine, "The virus was killing as many as 1 out of 5 patients older than 80. Patients of all ages with hypertension and chronic obstructive pulmonary disease were faring poorly." Callahan and his Chinese colleagues got curious about why many of the survivors tended to be poor. In reviewing 6,212 COVID-19 patient records, the doctors noted that many survivors had been suffering from chronic heartburn and were on famotidine rather than the more expensive omeprazole or Prilosec, the medicine of choice both in the United States and among wealthier Chinese. Hospitalized COVID-19 patients on famotidine appeared to be dying at a rate of about 14% compared with 27% for those not on the drug, although the analysis was crude and the result was not statistically significant, end quote. Back in the U.S., Callahan reported these findings to Robert Kadlec, Assistant Secretary for Preparedness and Response at the Department of Health and Human Services, as well as Robert Malone, Chief Medical Officer of Florida-based Alchem Laboratories, a contract manufacturing organization. Quoting Science magazine again, "Malone is part of a classified project called Domain that uses computer simulations, artificial intelligence, and other methods to rapidly identify U.S. FDA-approved drugs and other safe compounds that can be repurposed against threats such as new viruses." Malone had his eyes on a viral enzyme called the papain-like protease, which helps the pathogen replicate. To see whether famotidine binds to the protein, he would ordinarily need the enzyme's 3D structure, but that would not be available for months. So Malone recruited computational chemist Joshua Patel, president of Montreal-based Molecular Forecaster, to predict it from 2 crystal structures of the protease from the 2003 SARS coronavirus, combined with the new coronavirus's RNA sequence. The modeling yields several dozen promising hits that pharmaceutical chemists and other experts narrowed to 3. Famotidine was one. The compound has not popped up in vitro screens of existing drug libraries for antiviral activity, however. End quote. With the promising results from the modeling, they entered into a double-blind randomized study of COVID-19 patients, accepting those with decreased kidney infection because the high dosage of famotidine could cause heart problems for them. Because the use of hydroxychloroquine has become the standard of care for many patients, the study was unable to test the efficacy of famotidine on its own, but rather had to do so in combination with hydroxychloroquine. Quote, "Those patients would be compared with a hydroxychloroquine-only arm and a historic control arm made up of hundreds of patients treated earlier in the outbreak. Is it good science? No, Tracy says. It's the real world." While the official trial is still underway, there has been anecdotal evidence of its impact. Several people with COVID-19 took over-the-counter versions of the drug at the instruction of doctors familiar with the study and saw dramatic improvements in their symptoms. One of those doctors, David Tuvison, described it as a penicillin effect. Despite those promising cases, Tracy urges people to wait for results from the actual trial before getting their hopes up. Ending today with some local reporting on what it's like here in New York City. Healthcare workers from around the nation have been brought into the city to assist with the epidemic, and many are being put up in otherwise empty hotels. A number of the healthcare workers have been brought in by staffing agencies, like one called Crucial Staffing, that's Crucial with a K, which advertised paying $10,000 a week to nurses working 3-week stints in New York. It's a grueling job, though. Physician assistant Shadow Daniels from Pennsylvania said, "You come home, get your dinner, take a shower, get to sleep, and then do it all over again the next day. It's like going to war." At the New Yorker Hotel in Midtown, the ballroom has been converted into an intake area, with healthcare workers returning from shifts sanitizing their shoes before being allowed into the elevators. Cards and handwritten messages from the community decorate the walls of the ballroom. Other precautions are taken as well, like linens and towels being left in hallways in lieu of regular house cleaning. It's a far cry from the usual tourist-packed hotel interior, but it's the present reality for many hotels across the country. Quoting the Brooklyn Eagle, "More than 15,000 of the nation's 56,000 hotels and motels are now offering rooms for emergency and healthcare workers, according to Chip Rogers, president of the American Hotel and Lodging Association. 2 weeks ago, the Marriott hotel chain announced it would provide $10 million of free rooms for responders in New York City, New Orleans, Chicago, Detroit, Los Angeles, Las Vegas, Washington, D.C., and Newark. In less than 2 days, 6,200 nights in rooms have been booked, with 53% of them in the New York area." Said Michael Jacobson, president of the Illinois Hotel and Lodging Association, quote, "Hotels aren't making a profit out of this. It's allowing them to at least maintain some basic operations and, frankly, keep at least a portion of their staff employed," end quote. That is all for today. As always, this show was produced by Ride Home Media. Talk to you tomorrow.